All right, let's discuss this further now. That's the issue of COVID-19 as a whole, especially as it relates to Nigeria, and of course, the issue of stigma. I'm being joined on the program now via Skype by Dr. Ayodele Oluwole, who is a public health physician. Dr. Oluwole, thank you very much for joining us on the program.
Thank you for having me.
Yes, we know you're also involved in the training of the response team, especially here in Lagos. How is that going?
Yeah, that's going really well. There's been a lot of enthusiasm, a lot of volunteering that's going on, and then the state has put in machinery to provide adequate training for volunteers across all cadre, from doctors all the way to hygienists and cleaners in the state.
Oh, that's quite interesting. So people are actually volunteering.
Yes. A lot of people are volunteering, ready to go into battle, anytime.
Now, tell me. Now we understand we're beginning to see community transmission. How dangerous is that?
Yes. Those are the places we really they want to go. I mean, we started by having a single case that was imported into the country, and then we gradually saw contacts of those of the index case, and then all other contacts that were imported, and further contacts of those. But as that graph began to fall, we are now seeing more of cases who apparently don't have any contacts, have any travel history, and they have not had any significant contacts with persons who have had COVID-19. So community transmission is beginning to kick in, and then I think that we've anticipated that this might be, the next level of how the virus is going to move, and then the state and the country, I think, is putting all machinery in place to make sure that that is duly combated.
Please, I want you to educate us more on this issue of community transmission. You just said it. You're a medical person now, and you just said, and that's, of course, what the NCDC has said. These are individuals. These are individuals, no travel history, no contact with a confirmed case. So how could they have contracted the disease?
Okay, yes. Because of the peculiarity of this virus, of the SARS-CoV-2, we've seen that there could be transmission of the virus to persons without having symptoms themselves. So there could be asymptomatic transfer of this virus to other persons. So yes, we've not had history of contacts with somebody who has recently returned from places or countries where COVID-19 has been reported. Okay, but we also know that yes, there might be some undetected contacts. People have made travels. If you look at the GPS tracking of some of the contacts that eventually were followed up during contact tracing, you will find that so many people, because of human behavioral pattern of human beings, there's been a lot of movement, from state to state, and in the process, you could have possibly had transmission to other persons without necessarily having a direct link to them. Yes. So that might have been the reasons why we're now having a different state. You could see sporadic cases in different states, even though as Lagos State is the epicenter of the disease, but, people travel because of the epidemiologic pattern, of how people move in terms of transport, movement, trade, and all that.
I think I get your point perfectly. Say, for instance, if I was infected and, I just move around, say around Ikeja area, take a bus and all of that, there's a chance that other people on that bus or other people I meet on the way may get may catch it from me without these guys knowing. Okay. Now, how challenging do you think that would be, for for health authorities now to deal with? You look at the way we've dealt with the issue of those who returned and contracted and returned, imported the disease here. We've done very well with contact tracing. We've done very well with handling it. Is it going to be very difficult to handle this community transmission?
Yes, I think, there's no one size fits all. I've mentioned this one or two times before, that there's no one size fits all intervention or strategy to come this virus. And then, the next phase that will be able to deal with that is what we are looking at now, that Lagos State and I think the FCT have started to do, which is the active case search. Okay,
that's a house-to-house search.
Yeah, so there's a house-to-house search for COVID-19 like symptoms. So we are not actually even saying that it's COVID-19. There's been a relaxation of the case definition just a little bit, to accommodate persons who during the time that we are conducting this house have fever, for instance, acute respiratory infections and all that. And those can be extracted, tested at their own community level. And then if they are positive, okay, they can be isolated, okay, and have treatment accordingly. And if they are not, they are able to receive treatment for those. That's with every other thing that we are doing in terms of social distancing, hand hygiene, cough etiquette, and other things are supposed to help to slow down the transmission of the virus. Okay, so our house-to-house research, is supposed to address this. So if we're able to, whilst people are indoors right now, we're able to go from house to house asking for symptoms. You have fever, you have a respiratory, you are coughing, you are sneezing. Let us take samples, at that level, okay? I know that 20 centers are already doing that in Lagos State right now.
The success of that house-to-house search, of course, would be dependent on getting the cooperation of the citizens of Lagos State and wherever this house-to-house search would be happening. Because if they don't tell you the truth and you don't get their cooperation, then it's difficult to see how the program would work.
Yes, of course. That's why I mentioned that public education and awareness is really important at this time, so that the communities that officials will be going will be fully aware of what exactly government is trying to do. The period of lockdown is supposed to help to be able to identify a sizable number of persons, indeed there is a lot of persons that have been found to have symptoms and then are eligible for testing in the last 10 days. About over 100, I think the Honorable Commissioner mentioned about a few days ago, that has come up, and so that's in itself will help. And then public education is key, enlightenment, passing jingles, letting people know from their communities, that officials will be coming to their homes, to identify, to see if anybody is almost like a mobile clinic, and then there will be some reassurance from people, and hopefully they can cooperate to be able to have a very, very good result at the end of the day.
One of the challenges we've seen with COVID-19 in Nigeria especially is the issue of stigma. I mean, it's a big problem, and if it continues, it could derail the efforts of doctors like you and others that are out there on the front line, and it could even derail the country's response now to combating this pandemic. Stigma is a big issue. Unfortunately, we're also not seeing those who have recovered and recovered from this. We're not seeing them actually come out openly to speak about it as a way of breaking that stigma now. What do you think would be the best approach now to dealing with this issue?
Yes, there are several approaches, as to this. Of course, we know that when we talk about stigmatization, it could be it's in two prongs. Stigmatization for even the doctors and health workers managing these persons.
Oh, that's quite true. So doctors actually suffer stigma as well.
Yes, I mean, because when you naturally come, into a supermarket and they know you are now the neighborhood. Oh, you're a doctor. Are you involved in treating COVID-19 patients? You are careful to give information that, oh, yes, I am, so that, people can make a run for it.
That's quite
to say
true.
that, oh, it might come infect me, it might be infected. So it's in two ways, for health workers and for survivors at the same time. Okay, so the issue of stigma has been documented as factors that has reduced the public health of people, especially underserved and hard to reach people and vulnerable people. They tend to keep stigmatization can make someone keep symptoms and not come out to say that, oh, yes, I have these symptoms. And that can lead to more morbidity and mortality in the long run. Stigmatization can determine people's fate, So, yes, a lot of things can be done. Number one on it, of steps that can be taken is public education. Public education, public awareness. For instance, we know, and then if we set the record straight about myths and facts, if you set the record straight, we will know that the COVID-19 has been found that it is the virus is mild in about 7 to 80% of infected persons, and then it's just in 20% that you might even have a severe case. If people know that, and that is not a death sentence, and that you can get treatment early and recover early, then people would try to have a different thing to it. For instance, you look at HIV. Several years ago, if you're contracted HIV, it's almost like a death sentence. But a lot was done in terms of correcting, and giving proper information to the public. Now, if somebody tests positive for HIV, you know that, yes, there might be a little bit stigma here and there, but you know that it's not a death sentence. I'm going to leave work in my normal way. I'm going to do what everybody is doing. I'm going to use my medications, and I'll be fine. So that's extremely important. Another thing that we can do is to, of course, engage social influencers. So many people are home right now, and then so many people are glued on the internet. We can engage social influencers to put out, bright messages, and not focus on the green messages, which they're undeniable anyway. But they can focus on the survivors that we have, and that's very, very important. We can amplify voices of people who have lived the experience, who have survived. So we can bring in people are being discharged on a daily basis. We can encourage, them, of course, after having a lot of mental or psychology reviews and treatments, to come out to share their experiences, and then when people see that, yes, this person, had the virus, had gone through treatment, is fine, is hale and hearty, is ready to go, then more people will be encouraged to come out to say that, yes, I might have been in contact, knowing fully well that they will get good treatments. Of course, promoting ethical journalism is also important. When we put out information, on the front pages of newspaper and says that, oh, 20 persons died, or somebody escaped, we need to tinker with how we put out information, for people. And that, fear again is a major factor on how people can react to this. So there's so many approaches. When survivors come to say that, oh, the doctors in our treatment centers are wonderful, they are great, they take care of us. I mean, you could see the video of persons who are receiving treatment that went viral. It made a lot of difference.
Absolutely.
And that was done solely by the patient at the time. And he encouraged a lot of people to say that, oh, it's not really bad after all. There's even a joke around that says that, oh, we don't have food right now. Shouldn't we go into treatment centers where they provide a 3-square meal, and then we are doing fine.
Well, thank you very much, Dr. Ayodele Oluwole, a public health physician and also involved in the training of first responders over the COVID-19 pandemic. Thank you very much for your time. We'll take a short break now, and when we come back, we'll switch focus, but it's still going to be on the COVID-19 pandemic. But this time, we'll be talking about the business side of things. On DEJI360, we don't just ask the questions. What is wrong with amending the Constitution the way the National Assembly members have been doing it? We seek answers.
Constitution is constituent. Our problem is not lack of laws. Our problem is lack of the willpower to implement our laws.
Answers that provide clarity.
While we negotiate, we should try to make it a point that the girls must be complete.
The clarity you need to make informed judgment so that you can make the right decision and take action. People are saying it is you politicians that are responsible for this, that you are the reason why this is happening.
All these dollars that call themselves governors in this country?
I wish we had people like Tony at the National Assembly. God forbid that I go to join that band.
DEJI360, providing clarity to issues.